Welcome to today's video. If you've experienced neck strain or ongoing pain in the cervical region, you may already know how uncomfortable and limiting it can be. But what happens if you also have cervical degenerative disc disease, DDD? In today's video, we'll explore how a cervical strain can aggravate and accelerate cervical DDD, making your symptoms worse. Understanding this connection can help you take steps to manage both conditions more effectively. Let's start with a quick refresher on what cervical degenerative disc disease is. Over time, the intervertebral discs in your neck can wear down, losing their flexibility and ability to cushion the vertebrae. This is part of the natural aging process, but it can cause pain, stiffness, and even nerve compression if the degeneration becomes severe. Now, let's talk about how cervical strain can worsen this condition. Cervical strain refers to injury or irritation of the muscles, tendons, or ligaments in the neck. This type of strain usually happens due to overuse, poor posture, or sudden movements. When you strain your neck muscles, the surrounding muscles tighten up and fatigue quickly, leading to muscle imbalances. This muscle tension can pull on the cervical spine, placing extra stress on the already weakened intervertebral discs. Poor posture is a common outcome of cervical strain, particularly in today's world where many of us spend long hours looking at screens. When your neck is strained, you're more likely to adopt a forward head posture, which puts abnormal pressure on the cervical discs. Over time, this added stress can speed up the degenerative process, causing more wear and tear on the discs. Another factor to consider is how muscle imbalances caused by cervical strain can worsen disc degeneration. When certain muscles in your neck are strained, others may have to work harder to compensate. This compensation leads to increased pressure on the cervical discs, especially in areas where the disc is already thinning or weakening due to DDD. This constant strain leads to accelerated disc degeneration, making the symptoms of DDD, like pain, stiffness, and reduced range of motion, much worse. Chronic inflammation is another key contributor. When you have cervical strain, the muscles and tissues surrounding the cervical spine often become inflamed. This inflammation can spread to the discs themselves, further irritating the already degenerating tissue. Over time, chronic inflammation can lead to more rapid deterioration of the disc, aggravating the symptoms of cervical DDD, such as nerve compression, pain radiating to the arms, and limited mobility. On top of that, muscle stiffness caused by cervical strain reduces your neck's range of motion. With reduced flexibility, it's harder to maintain proper spinal alignment, which forces the discs to absorb more impact during everyday activities. This excess strain speeds up the degeneration process, worsening the condition of the cervical discs. Ultimately, the combined effects of muscle strain, poor posture, and increased pressure on the discs can significantly worsen the symptoms of cervical DDD. This may lead to more severe cases of nerve compression, resulting in pain that radiates down the arms, numbness, or even weakness in the upper extremities. So, managing cervical strain is essential to slow the progression of DDD and reduce the severity of your symptoms. By addressing cervical strain early on, you can help prevent these aggravating factors from speeding up the degenerative process in your cervical spine. One of the best ways to assess the extent of your cervical DDD and any damage caused by cervical strain is through imaging tests. An MRI magnetic resonance imaging is the most useful tool for evaluating both cervical DDD and the impact of cervical strain. MRI scans provide detailed images of the discs, vertebrae, and surrounding tissues, showing whether there is disc degeneration, disc herniation, or nerve compression. In some cases, an X-ray can also be helpful to visualize the alignment of the cervical spine and identify any bone changes or disc narrowing that may be contributing to your symptoms. If you're dealing with cervical strain and have been diagnosed with cervical degenerative disc disease, it's essential to work with your healthcare provider to manage both conditions. Addressing strain, improving posture, and staying active can help slow down the progression of disc degeneration and relieve your pain. Thanks for watching, and take care of your spine health.